Three people have changed the game of baseball. Jackie Robinson, Marvin Miller, broke the free agent barrier, and Frank Jobe for coming up with Tommy John surgery. Those three guys have changed the game of baseball for the better.
One person who knows firsthand the impact of the late Dr. Jobe is Metz surgeon Dr. David Altchek. For more than 20 years, he's been performing the Tommy John surgery. In fact, Altchek created a new way to enhance the surgery called the docking technique, commonly used in today's surgery.
The docking technique involves several components at once. So the ligament is covered by that big pop-eyed muscle on the inside of the elbow. It's called the flexor pronator. So in the original descriptions of the surgery, you had to take that muscle off to get to the ligament. We developed a way where you can just split the muscle, leave it attached, much less trauma, also much quicker surgically. Then we figured out a way of getting to the ligament without moving the ulnar nerve, so the ulnar nerve could stay happy in its place. Thirdly, we didn't like how Dr. Jobe made three big bone tunnels in the humerus bone that sticks out called the medial epicondyle. And so we devised a way where we could do it with one single tunnel as opposed to three. So that minimized the time of the surgery and, more importantly, the trauma to the elbow.
Years back, during a presentation to explain the procedure, Altchek noticed a familiar face in the crowd, that of Dr. Jobe.
You know, I was this young doctor, and you know, he's the venerable Dr. Jobe, and I was sort of up there telling the world that I had another way of doing his operation, and, you know, that it seemed to be good, you know, and so in a way I was sort of challenging his authority, challenging his expertise, without meaning to. I was just trying to push the field forward, but you never know how people are going to react. Let me tell you, surgeons have big egos, you know, and Dr. Jobe, I learned that day what kind of man Dr. Jobe was. He came up to me and I was like, oh my God, here we go, after my presentation, and he just congratulated me and wanted to talk more about it, and that was the beginning of a great friendship between the two of us.
Altchek says he's performed more than 1,000 Tommy John procedures over his career, believing the younger the patient, the higher the success rate.
I mean, success rate is around 85%, 90%, somewhere between 85 and 90. Kids are like the Terminator. They're healing in the car ride home.
However, even the youngest patients face obstacles. Back in 2010, Altchek performed Tommy John surgery on an 18-year-old left-hander named Steven Matz. While the original surgery was successful, Matz endured nearly 2 full years of setbacks before pitching at full strength on his way to becoming one of the organization's top pitching prospects.
I didn't feel too worried going into it. Altchek was pretty encouraging when he told me I needed it. He said, you know, the success rate's really high, and then as soon as I started throwing, I think it was like 4 months in, is when my elbow started to flare up a little bit. There was setbacks through my whole throwing program. I would throw, I started throwing for probably 2 weeks, and then I had a setback, and they shut me down for a couple days. So I actually had 2 PRP injections, one from Dr. Altchek, and then I went to go see Dr. Andrews. Then it was a couple months later, next year, I went to go see him again. For another opinion. He's like, you might as well just go out there and just, you know, just let it rip. If it's torn, then it's gonna either tear more or it's gonna hurt, or if it's a little piece of scar tissue or whatever, it'll just break up and you'll be fine. So that's what I did, and really never felt anything since.